Muscle pain is incredible common symptom. It affects around 80% of world population at some point of their life. We will discuss most common causes of muscle pain, and most common cause is muscle overuse or physical injury. It happens around 50 to 60% of cases. Common symptoms are muscle pain, stiffness, tenderness, soreness, and weakness. Muscle overuse or injury typically affects lower back, shoulders, neck, and legs. A diagnosis usually made by clinical history, clinical examination, and history of repetitive use or physical trauma or high intensity exercise. Treatment usually is rest, ice compression, elevation, non-steroidals. In rare cases, surgery also may be needed, but such cases are rare. Mechanism of action is breakdown of muscle fibers, and it causes inflammation, it causes increased level of inflammatory mediators, and it causes pain and tenderness. Most common cause of muscle overuse is physical activity, repetitive movements, and sometimes athletes don't warm up or stretching before intense exercise, and on such people muscle pain is common. Another common cause of muscle pain is inflammation. Inflammation occurs around 15% of cases. Symptoms include muscle swelling, redness, and heat. In case of overuse and injury, it's rare that swelling, redness, and heat, but in case of inflammation, it's common symptoms. Location usually are large muscles, for example thighs, shoulders, and hips, and if muscle overuse and injury affects usually younger people and athletes and physically active people, inflammation usually affects elderly and middle-aged people. What is causes? Causes are usually autoimmune diseases such as rheumatoid arthritis, lupus, polymyositis, and viral infections. Risk factors include autoimmune conditions, obesity, and smoking. Here is important fact that sometimes if person has viral infection, they have muscle pain, and it is caused by inflammation caused by viral infections. Treatment is non-steroidal anti-inflammatory drugs, corticosteroids, physical therapy, rest, and in some cases immunosuppressive therapy also is needed. Another common cause of muscle pain is nutritional deficiency. Nutritional deficiency occurs in 5% of cases. Of course, 5% itself is not big number, but if we consider how common is muscle pain, 5% still high. Symptoms include muscle weakness, cramps, and spasms. So here pain nature is different. Muscle cramps and spasms are characteristic of nutritional deficiency. Most common deficiency nutrients are vitamin D, vitamin B12, and magnesium. Usually such thing happens in people with poor diet and malabsorption. Treatment is nutritional supplements. Also, some medications can also cause muscle pains. Such medications are statins, antidepressants, antibiotics, and ACE inhibitors. Also, several other drugs such as antipsychotics can cause muscle pain. That's all. Thank you for your interest. If you like my channel, please subscribe and make like. Thank you very much. Bye for now.